Well, nurses really are the heart of healthcare. They're often the first point of contact for patients and their families, doing more than providing care. They offer support, advocacy, and education. Michigan State University has been training these crucial pieces of the system for 75 years. A milestone to celebrate for sure. Welcome to Ann Sheehan and Jackie Eisler from the College of Nursing. Ladies, thank you so much for being here.
Thanks for having us.
Yes. Let's talk about 75 years. What a huge milestone, and what the school's doing to celebrate.
Lots of different activities are going on in the college this year. We just graduated another class of graduate and undergraduate nurses. Over the 75 years, we have graduated about 10,000 nurses in Michigan. Amazing. So yeah, in our undergraduate and graduate programs.
Yeah. Absolutely, and I think it's also important to remember our roots. We started out as the MSU Nursing Education, Department of Nursing Education, and then gradually into the School of Nursing, and then eventually spreading out to the College of Nursing.
Okay, I mean, you've kind of changed as the position has evolved.
Right.
Let's talk about that evolution. You know, it's Nurses Week, and celebrating all that nurses do, because that has changed very much from what they were probably 75 years ago to what a nurse does today.
Right. So nurses work very independently today. I know back in kind of the olden days in films, we see that the doctors are telling the nurses what to do, and that is not how nurses function now. So even RNs at the bedside are very autonomous in the work that they're doing. There are a group of what's called advanced practice registered nurses that include clinical nurse specialists, nurse practitioners, nurse midwives, and nurse anesthetists. And they all function very independently in providing patient care.
Yeah. And then let's talk too about the other types of roles there are, because I think people don't know how many different opportunities there are in nursing.
Yes, there's a variety of different roles that nurses do play in healthcare today, from anywhere from, you know, our traditional, what we think of our nurses working at the bedside, at the hospitals, and then the clinics, and then clinical nurse specialists, which is one of the advanced practice registered nurse roles. And we work with patients, we work with the nurses and the organizations into really how can we improve healthcare outcomes. For example, infection rates. So by working with the different teams and putting in the evidence and the research that we have together, really work out a sustainable plan to really improve those outcomes, which overall improves healthcare for all that reaches healthcare.
I mean, because they're the boots on the ground. They're front and center, right? And they know what's happening with these patients every single day.
Right.
Yeah.
And then with the nurse practitioners having advanced education in diagnosis, assessment, diagnosis, treatment, a lot of people don't realize that they can choose a nurse practitioner as their primary care provider. So we really can help the situation that we have in Michigan with access to care. 82% of our counties in Michigan are designated underserved. That means there are not providers in those areas, whether it's a physician or a nurse practitioner. So having nurse practitioners work in those areas really will help healthcare, and like Jackie was saying, population health and just helping outcomes for healthcare.
Absolutely. I mean, well, let's expound on the need, because it is great. And I mean, I know I see a nurse practitioner, my daughter, that's commonplace, and there just aren't enough still.
Right.
And let's talk too about, you know, kind of the changing evolution of what that school looks like and what the training looks like to become a nurse practitioner.
Right. It definitely has changed with how we do education, from where we would sit and listen to lectures, read all the books, read the articles, do the tests, and now into more of that simulation training that we have, more of that experiential training, looking at how we do clinicals, where the nursing students go into the hospitals or the clinics to practice as a future nurse. That has also changed. And I know we have a really nice simulation center that Ann can talk about.
Yep, and we just, through a generous donation, we were able to upgrade our simulation facility, so we're state-of-the-art now. And we also have a one-of-its-kind immersion room for students to go in and experience what it would be like, for instance, going into someone's home to care for a patient in a home.
Wow.
So they've got that real-life experience before they actually have the face-to-face with the patient.
Wow, such a valuable experience.
Absolutely.
Yeah, you got to learn by doing it, right?
You got it.
And then tell some things that people might be surprised about nurses. Some roles and positions that nurses can take that people might not understand.
Right. I think one of the things that I think may be surprising to most people is that there's 5.2, give or take, million nurses in the United States. And out of those, 13% are male nurses. So we could use more men in nursing,
Sure.
of course.
Yeah.
And some of the other roles that we have, nurses are in policy, state, national, federal level. Really, how can we improve healthcare? And some of those policies do need that nurse's touch to it. In addition to like nursing informatics, so working with the electronic systems and how charting happens and how can we make those improvements, because a lot of the time that we're spending on is on charting. Some of the other, we're looking at like psych mental health nurse practitioners. We also have those because there is such a great need for mental health. And I believe May is Mental Health Awareness Month. Yeah. And so that was a nice little, just to share that there's other resources out there available for people that are seeking help.
Carrying that forward too are the nurse researchers,
Yes.
as scientists that we educate, and all of the ways that research impacts how we inform health policy, what we can get, and what we put into the electronic health records, and how we can get that out to do the research and collect the data that is needed.
So amazing.
Yeah.
So much more than that bedside nurse that everyone envisions, right?
Absolutely.
Right.
Truly advocates in the medical care system. Ladies, thank you so much for being here. And of course, we're so lucky to have MSU here, accessible to all of us. You want to learn more about the programs they have available, nursing.msu.edu. Of course, you can always give them a call too, 517-353-4827.